So welcome back to Better Health coverage here live at HIMSS 10. I'm Mike Sevilla. And here we have Pranam Ben from Visions at Work. So thank you so much for taking the time. The founder and CEO. So thank you so much for taking the time here today. So people who may not be that familiar with Visions at Work, what can you share with our audience?
Visions at Work is a strategic solutions provider for healthcare as an industry. I personally come in with many years of experience in developing healthcare IT solutions for enterprises worldwide. So we built a product that addresses a very niche need when it comes to continuity of care and better coordination of care. And what we're doing now, we've actually partnered with a solutions major in NIT technologies, and we're looking to promote Prefer worldwide using NIT as a partner.
Sure, sure. So you mentioned you're the product guy. Yeah. So can you tell us a little bit about the product?
Sure. Prefer, it's an acronym for patient referral, and even the domain is www.prefer.net, which actually is worldwide patient referral network, which is what we want to be. So the need that we're trying to address here is that when patients are being referred from one point to another, the issue we have today is that the patient's information does not flow. And not only does the patient's information does not flow, there are multiple versions of the patient's information that are being shared between the different entities. That leads to duplicative care, unnecessary follow-up tests, and more burden on the patient. So Prefer is a web-based platform that we hope to help address this particular issue in healthcare, so that one version of the patient's information is shared and one version of the patient's information is always ahead of the patient.
I see. So you mentioned point to point, one point to another point. Can you give an example of that?
It could be, if a primary care is referring their patient to the hospital for an outpatient service, and the hospital in turn refers the patient to a specialist for a follow-up, the primary can actually track the patient's movement and share the information with the hospital, schedule the patient for the hospital service, and also provide the patient's health history information, which in turn will enable the hospital to have the right information before the patient arrives for their care. And when the patient arrives and shows up and is being in turn referred to a follow-up specialist, the primary care can track that progress being made so that they can plan their follow-up. They can in turn plan their follow-up when the patient comes back to them.
So they track it with this piece of hardware.
The way we have provided the software is that the software is available as a service. So all the providers would come online, create an account in less than 10 minutes, and start using the system. So all they need is a PC with an internet connection. So there's no hardware, no software licenses, no implementation time, and no maintenance issues. So they come create the account. As long as you have a PC with a web connection, you can start using the product and refer the patients, and also use Prefer as an online patient information repository, both demographic and clinical.
I see. So is this clinical information or is this billing and payment information?
It's both. It has a context on both from a demographic, insurance, and clinical standpoint, because when you are actually managing the referral information, you are touching upon the patient's demographic information, like I said, the patient's current clinical and past health history, because the fact that the patient had a surgery 6 months ago could be relevant to that episode of care. You know what I'm saying? So it does touch upon all the different facets of the patient information, and we enable a seamless exchange, a secure exchange, and a secure storage, which is an online repository of the patient's information.
Now, it would seem to me that some of the EMR products out there right now kind of have this function. Is that,
The beauty about this is that, we sit on top of any backend EMR and standalone applications. We are more of a front-end collaborative tool that helps the entities communicate and exchange the information with each other using the web as a platform. So if you have a backend EMR system, we would come on top of it, interface with the EMR system, pull up the patient information, and transport it to the point B from a scheduling and a referral standpoint. That makes sense, yeah.
So if I refer somebody to a specialist and then they send me back information, how would that work?
Again, they're going to log into their account on Prefer, so they're going to process the referral, and then they're going to send the follow-up back to you via a secure messaging infrastructure that we have on Prefer. So the messages are sent back and forth on your Prefer account. So when you log in, you would see the messages that have come from the provider that you've referred the patient to, and you can in turn, so it's a call to action for you to plan your follow-up.
So these accounts, are they by physician or they're by group? How are they set up?
It's actually by user. So as a provider, depending on how big your organization is, you could be a 1 doc practice or a 100 doc practice. Depending on the scale of your organization, you would sign up more users onto the system. As a user, you have the privilege to pretty much do everything that's available on Prefer. Depending on how many patients you handle on a given day, you might sign up 10 users or 1 user, depending on how you want to use it.
So are you saying that the specialists that use this, or the hospitals, they have to have their own separate account as well?
That is correct. So if you are a primary care, as an example, if you are a primary care, you have a user account on Prefer, you would log in, initiate the referral, for example, right? And then the hospital to whom you have referred your patient would in turn have a Prefer account, and they would log in and receive the referral and process the same. And they can in turn transmit referrals to other providers. So it's almost like a any-to-any referral platform, and it's provider agnostic, it's EMR agnostic, it's size agnostic, and it's specialty agnostic. So you could be any type of care provider, and as long as you're sharing and exchanging patient information with other providers in the community or otherwise, you have an opportunity on Prefer.
So it's kind of like a subscription model. I have to subscribe to be a part of the system here.
The entire software was built on a software as a service model, and it's available as a subscription service. Correct. You would be a subscriber into the system to use the system. Yes.
So what kind of price point are you looking at with this type of subscription?
We have different pricing models. We have a pricing model for a non-hospital type of provider, and we have a pricing model for a hospital provider. Because for the hospital, it's more strategic, because they are going to use this as a tool to monitor and manage the physician relationship, the referring physician relationship. You know what I'm saying? So today they are challenged with the need to have a tool that will help them monitor and manage the physician relationship, and the goal was to give them a tool that will help them be more proactive about the relationship and not have a reactive approach to managing that the very key relationship that drives the financial health of the hospital.
I see. If you could kind of share again your association with NIT Technologies.
Sure. NIT Technologies, it's a brand, it's a global brand, and both in North America, Europe, Asia, they're a well-known company. And I wanted a brand like NIT to help promote Prefer worldwide. And the beauty about Prefer is that what I'm trying to achieve is trying to address a need that has global impact. Like if you go to the issues around the referrals, and the fact that it's paper, phone, or fax based, it's pretty universal in nature. You go to Japan, which I've been to, and it's the same process. You go to UK, you go to India, you go to the Middle East, it's the same process. And building a platform which is internet based helps you deliver a simplistic solution to help address this very niche need. And have a universal impact. So I wanted a company that had a universal presence to take my product worldwide, and that's the reason I partnered with NIT.
And visionsatwork.biz. Is there it? Okay, great. So Pranav Ben from Visions at Work and also NIT Technologies. Thank you for coming. Thanks for the time.
Thank you so much. Thanks for having us here.
Okay, great. And Better Health's coverage continuing here at HIMSS 10 will continue in a little bit. We'll be right back.